Today I am going to do OET letter introspection of 3rd December 2022. So, in today's letter, today's date is being given 8/1/2022. Your registered osteoporosis specialist nurse in the Maxwell's Hospital, Melbourne. Elizabeth Hill is a patient in your care. Now the patient detail is being mentioned. The name of the patient is Elizabeth Hills. A marital status is widow. Address is being given. Phone number is being mentioned. Date of birth 1/7/1930. Her age is 70 years. Next of kin. One daughter lives in Riverview Highway. Visits once a month. One son married with two children lives in Highway Queen Street, Melbourne. So before proceeding as per the writing task, using the information given in the case notes, write a referral letter to the physiotherapist. So in your letter, you will have to write every detailed information that a physiotherapist will require in his further management. So irrelevant things should not be included in your letter. Social background, she is a retired accountant. Financially, she is independent, enjoys watching soccer. Medical background, she has osteoporosis, impaired mobility and self-care activities, so she is unable to perform her activities of daily living. She has history of falls, probably because of osteoporosis. Admission diagnosis, swelling, bruises and tenderness on the left wrist, severe difficulty with mobility. So she has been diagnosed with left wrist distal radius fracture. She presented to the hospital on 8/10/2020, complaining of excruciating wrist pain, tenderness, bruises and swelling. A DEXA scan was performed and which confirmed left wrist distal radius fracture, which was managed with plaster cast. Review was being scheduled after 2 months. Next comes the nursing management. So removal of the plaster cast, advised to restrict the activity of the impacted wrist with a sling for optimal healing, and commenced on appropriate treatment plan to manage her pain and inflammation. Experience pain, stiffness, decreased range of motion in the area. So she was instructed for muscle strengthening exercise for improving range of motion and advice for continuity of exercise at home. This particular letter is being given, has been written to a physiotherapist. So in this particular letter, you will have to mention regarding the exercise regime. On 20/12/2020, pain persisting, inability to perform activities of daily living, and non-compliance with exercise program. So she's non-compliant with the exercise program, which was being advised by the doctor. So medication is being mentioned. In her discharge plan, she has to avoid strenuous activities, follow visit after 6 weeks. Then it is stated that community nurse to monitor the medication compliances. And as I am writing to a physiotherapist, nothing regarding community nurse job has to be mentioned in that letter. She has been recommended a rehabilitation program supervised by a physiotherapist for restoring movement and strength of the wrist. She will be reviewed in a follow-up appointment that is on 15 Jan 2022. In the writing task, it is stated that using the information given in the case notes, write a referral letter to the physiotherapist, GNB Medical Center, Sacrament Road, Melbourne, regarding Mrs. Hill's physiotherapy needs at home. So there should be a home visit. The date of the letter is 8 January 2022. We are writing to the physiotherapist, GNB Medical Center, Sacramento Road, Melbourne. Dear Sir or Madam. That means the name of the physiotherapist is not being mentioned. That is why we are writing Sir or Madam. So the reference is Mrs. Elizabeth Hill, aged 77 years. So I'm now talking about the introductory paragraph. The purpose of this letter is to introduce Mrs. Elizabeth Hills, who requires a home visit for rehabilitative care and management to facilitate her wrist movement. So she has fracture on her wrist. So the plaster cast has been applied, and after that she has problem with movement of the wrist. She is recovering from wrist fracture and she has a history of osteoporosis. She is being discharged today. First body paragraph. Initially, Mrs. Hills presented to a hospital on 8 October 2020 with an excruciating pain on the left wrist, following a fall onto the outstretched hands. On examination, so the patient's wrist was examined and we found that there was tenderness, bruises and swelling. Her DEXA scan confirmed that she has left wrist distal radius fracture. Consequently, she was managed with a plaster cast and medications. Apart from that, she was advised for a follow-up visit. That's on 8 December 2021 for the removal of plaster cast. Okay, in the final paragraph, it would be appreciated if you could assess her condition and provide the appropriate exercise program. Please make sure that her next review is on 15 January 2021. Please do not hesitate to contact us if you have any further queries. Yours faithfully, Charge Nurse, Maxwell Hospital. I have written yours faithfully just because the name of the physiotherapist is not being mentioned. Do not forget to like, share and subscribe. Thank you for now.